Welcome to the Clearly Beneficial podcast, the show where we rip off the Band-Aid and explore the future of healthcare, benefits, and the people driving innovation in the industry.
Vincent Catalano here, Clearly Beneficial podcast, and I'm going to do something a little, unorthodox perhaps today. I wrote this article for the advocates.org. It's a organization focused on self-government and accountability, and in cooperation with my dear friend Diamond Michael Scott, he asked me to write an article about self-directed healthcare and stuff in the industry. And I came up with this, I think it's a pretty good article called Healthcare Systems Are Not Going to Save You. So instead of, me rambling on about what's in the article, I'm actually just going to read the article to you. I think you might find it to be entertaining. It's going to take a minute. I think it's probably about a 6 to 7 minute read or listen. But I think it highlights some very interesting things about the healthcare systems that we face and how you, as a consumer of healthcare, can make good decisions that keep money in your pocket and not in the insurance company or the provider's pocket. So I'm going to let this kind of walk through this with you, and here we go. So I've often said that navigating healthcare is a full contact sport. You get sick and then what? Most people freeze, defer to the most expensive option by default, and end up paying for it in more ways than one. All of this begs the question, what if the single most powerful thing you can do for your health and your wallet was simply to understand how the system works? That's what I'm sharing with you. Not policy or politics, but practical knowledge that puts you in the driver's seat where you belong. The broader argument here is worth stating plainly. The best healthcare system for you as an individual is one where you call the shots, not a government agency, not an insurance bureaucracy, not a hospital billing department, but you. The market has unfortunately failed to give consumers real price transparency. Mandates and regulations have obscured real costs. Employers and insurers have intermediated the relationship between patient and provider in ways that strip out accountability. The result is a system that often works against the very people it's supposed to serve. The antidote is not more centralization, it's just more you. Start where you are. Prevention is leverage. If you're healthy, stay that way, reduce your risk factors, eat well, don't smoke, exercise consistently, manage stress, and keep your social connections strong. These are not platitudes, they are compounding investments in your most important asset. The self-directed case for prevention is simple and has nothing to do with government mandates. Your health is your property. Protecting it is an act of self-ownership. The choices you make about sleep, diet, movement, and stress management either add to your long-term capital or erode it. No insurance policy substitutes for that. That being said, even if you do everything right, something may catch up with you. Prevention is leverage, it is not guaranteed. The goal is to reduce the odds and be prepared when life fails to cooperate. So the 5 terms you cannot afford not to know. You better know these cold. Before anything else, you need fluency in the language of your own insurance plan. These 5 terms are not negotiable. Premium, your monthly cost per coverage, whether you use it or not. 2, deductible, what you pay out of pocket before your insurance begins to cover cost. The you pay first. Coinsurance, a percentage split between you and the insurer after your deductible is met. A typical arrangement is 80% to the insurer, 20% to you. Copay, a fixed dollar amount for a specific service, regardless of the total bill. Like going to the doctor, you might have a copay. For a drug, you might have a copay. Annual out-of-pocket maximum, the ceiling on what you will pay in a given year, right? Once you hit it, the insurer covers 100%. This figure typically runs between $3,000 and $8,000 for individuals and roughly double that for families. These are accrued on a calendar year basis for the most part. Know these numbers cold. They are the terms of your contract. Ignorance of them is expensive, and in a system that doesn't volunteer clarity, a lack of knowledge is what the system counts on. Where do you fall on the continuum? A useful frame. Roughly 80% of people are reasonably healthy and incur minimal medical costs in a year. Think about that. About 19% have something going on that requires genuine care. The remaining 1% account for approximately 50% of all healthcare spending. So 1 in 100 people represent half of the total cost of healthcare spending across the US. Knowing where you sit on this continuum shapes every decision you make about coverage, savings, and care. Healthcare is also one of the few goods you cannot effectively comparison shop in real time. Pricing is opaque by design. Your access to cost tools depends heavily on your insurance type: employer-based, ACA marketplace, Medicaid, Medicare, or uninsured. Each operates by a different set of rules, and your job is to know yours cold. This opacity is not an accident. It is the predictable outcome of a system built by third-party payment, regulatory capture, and institutional incentives that reward volume over value. When you are not the one writing the check at the moment of care, the natural feedback loop between price, quality, and consumer choice is severed. Restoring that feedback loop, even partially, is what self-directed care is fundamentally about. The 2 a.m. test, avoiding the most expensive door. Consider a scenario that plays out thousands of times a night across this country. It's 2 a.m. on a Saturday and you have abdominal pain that is not abating. The first thought is for most people to head straight to the ER. That instinct is understandable and sometimes it's right. But the ER is the most expensive place you can receive care, and in most non-emergency situations, it is entirely avoidable. Here's a hypothetical example. A 4-hour ER visit generated a $15,000 hospital bill. After the insurance applied the deductible and out-of-patient provisions, the patient share came to $5,000. For a non-emergency that could have been handled another way, that's a costly default. Here's what most people don't know. Nearly every health plan offers a 24-hour nurse line or telemedicine access. These resources can triage your situation and determine whether an ER visit is actually warranted. If the pain subsides, a Monday morning call to your primary care doc may be all you need. That single decision can save you thousands of dollars. Beyond cost, this kind of triage is an act of self-governance. You are gathering information, weighing your options, and making a reasoned decision rather than defaulting to the most expensive and least targeted intervention available. That is exactly the behavior a functioning healthcare market would reward, and exactly the behavior that is most beneficial to you personally. If you're uninsured, you have more options than you think. The uninsured often feel they have no options, so they end up in the ER by default. What most people don't know is this. If you present to an emergency room without insurance, many hospitals can now enroll you in Medicaid on the spot if you qualify. If you don't qualify and can't pay, hospitals write off unpaid bills from patients with no assets. Collections on zero asset situations rarely produce results. But if you have a home, car, or bank accounts, collection agencies can pursue wages, place liens, and create lasting financial damage. The key is to engage early and proactively. Do not ignore the bills. And here's the most important thing the hospital will not tell you up front. They're required to offer you a payment plan. Beyond that, they will negotiate the total balance, particularly for the uninsured. Hospitals routinely accept 30 cents on the dollar from insurance companies. There's no structural reason they won't do the same for you or better. You just have to ask. This negotiation dynamic reflects a broader truth about voluntary exchange that gets obscured in healthcare. Prices are rarely fixed. They are starting positions. The person who walks in informed, asks direct questions, and engages the billing department as a peer rather than a supplicant almost always comes out ahead. That's not gaming the system. It's how markets are supposed to work. Cost transparency. You are right, not a favor. For non-emergency care, cost shopping is not only possible, it is your right. Most health plans now include cost estimators that allow you to compare prices for the same doctor's visit, imaging procedure, or lab work across different providers. The variation is often striking, and the hospital is always the most expensive option on the list. As an aside, even in the same city, 2 separate hospitals will charge vastly different amounts of money for the same procedure. Whether you have insurance or not, you're entitled to request an estimate before you receive services. This is not a rude question. It's a smart consumer exercising a basic contractual right. If you have insurance, your plan documents spell out what specific services cost under the plan, so be sure to read them. There's a growing movement driven in part by direct primary care practices and cash pay clinics and even concierge medicine to make healthcare pricing transparent by default rather than exception. These models build on direct voluntary relationships between patient and provider, often deliver comparable care at dramatically lower prices precisely because they cut out the administrative overhead of third-party billing. They are worth knowing about and in many cases worth choosing. The HSA, or Health Savings Account, one of the most underused financial tools available. If your employer offers a consumer-directed health plan or you have enrolled in one through the ACA marketplace, you may be eligible to open a health savings account. This is one of the most tax-efficient vehicles in the entire financial system, and it's systematically underused. The mechanics are compelling. Contributions are tax-deductible, earnings grow tax-free, and withdrawals for qualified medical expenses are also tax-free. If your employer contributes to your HSA, that money is yours immediately. There's no use it or lose it. Annual contribution limits apply with catch-up provisions available after age 55. I believe that the best strategies are straightforward. Contribute consistently, keep the money invested and growing, and avoid touching it until later in life. An HSA can be used in retirement to pay Medicare premiums, out-of-pocket medical expenses, and long-term care costs. It functions as a second retirement account with healthcare designation. Few people take advantage of it. You should. From a self-governance perspective, the HSA is also philosophically significant, and it shifts the financial relationship in healthcare back toward the individual. Your money, your account, your decisions. It creates exactly the kind of skin in the game that makes consumers more deliberate, more price conscious, and ultimately better stewards of their own care. Government policy rarely produces elegant outcomes, but the HSA is one worth using to its full advantages. The bottom line, be your own advocate. The healthcare system is not designed to make things easy for you. Pricing is opaque, incentives are misaligned, and default pathways tend to be the most expensive ones. But the system does have rules, and if you know the rules, you can work them to your advantage. Know your plan's key terms. Use the nurse line before the ER. Ask for a cost estimate before you accept the service. Negotiate a bill if it comes to that. Fund your HSA like a second retirement account. Explore direct primary care or cash pay options in your area. None of this requires a policy degree. It requires the willingness to treat your own healthcare decisions with the same deliberate attention you'd give any major financial commitment. The deeper point is that no institution, no program, no mandate will be ever invested in your health as you are. Systems operate on averages. You are not average. You are a specific person with specific needs, specific risks, and specific resources. The more authority you take over your own care, the better your decisions will be, and the less subject you will be to a system that profits from your passivity. Being your own best advocate will reduce stress and save you money. The system is navigable. You just have to decide to navigate it. So thanks for listening to all that. I think there's some gems in there that you could definitely benefit, that are clearly beneficial. And I think that you'll share this with people. Share this with all your friends and family. Share this with people at work. Share this with your HR team. These are the basics, folks. And if you follow these rules, you're going to save yourself a lot of money in the long run. I've always commented that once someone gets diagnosed with something, they become a patient, and they lose all sense of self-control. I've seen it in my family. It's happened to me. You just become this thing that goes along for the healthcare ride. But it doesn't always have to be like that. It pays to ask questions. It pays to talk to the providers. And one of the key points of that article is basically, if you're going to struggle paying a bill with a hospital or another provider, you need to engage with them and talk about it. Do not ignore it. Also, there's two things, and one thing I should have covered in the article is there's the bill you get, and then there's the EOB you get, evidence of benefits you get for the insurance company, presuming you're insured. It's the EOB that tells you what you might owe. So if you look on that EOB and it says you might owe $500, and your bill from the hospital says you owe $5,000, they're out of sync. The bill from the hospital system or the provider needs to be equivalent to what is on the EOB. So keep that in mind. And thanks for listening. I appreciate you as a listener. This podcast has been growing. We have great reach around the world, and having great guests are coming up. More great guests are coming up, and I'm excited to be here with you. So take care, and we'll talk soon.
This podcast reflects the personal views of the host and guests, not their employers or sponsors. See you next time.